Thank you, Mr. Speaker.
Thank you very much. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Mr. Speaker, for years, thousands of Nova Scotians have wondered and worried about the impact of Northern Pulp's future on their future and the future of their community. On Friday, we learned that a decision on Northern Pulp's ability to operate in this province and meet our environmental standards is still some time away. I'd like to ask the Premier, is the government preparing a plan to support industry workers and entrepreneurs in any way in the event of a closure, temporary or permanent, at the mill?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the questions. I've said many times, we continue to look at all options. How do we diversify the residuals that we see in our sawmills across the province? The Northern Pulp, of all the mills in the province, was the most integrated one when it comes to every sawmill in the province. The impact is far beyond Pictou County. It hits every community. We're looking at options of diversification, but we're also, Mr. Speaker, continuing to hope and look forward that the company will continue to provide an EA, Mr. Speaker, that meets the environmental standards of our province, so we continue to keep those mill workers working.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Northern Pulp has indicated that it may close without a change to the Boat Harbour Act, and the Premier's referenced, I think in his words today, and certainly a number of times before, a committee that's been struck to look at options to diversify our forestry economy and look at ways that we can have a strong forestry industry in this province going forward. I'd just like to ask the Premier if he can elaborate on that committee. When was it struck? And if he can maybe update the House on the work of that committee that he's mentioned.
The Honourable Premier.
Thank you, Mr. Speaker. It was struck, Mr. Speaker, at the beginning of the year, late December, early January of this current year. The work is ongoing, reaching out to a partner to see around diversification, ensuring, quite frankly, the stability of the pension plan that is currently there, not just for current workers, but those who are currently receiving pensions out of the facility. How do we look at the magnitude of the impact if the mill goes down across a number of sectors? We'll continue to do that work. At the same time, again, Mr. Speaker, it's my hope that the company responds to the request of the information that's required around an EA, Mr. Speaker, and the one that they can fit that meets the environmental standards of this province and one that will allow those mill workers to continue to work.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker, and I do appreciate the Premier's response on that. Many people are worried about the outcome of this situation. Many people are worried about the impact on their future, whether they work in fisheries, whether they work in forestry or at the port here in Halifax. People are worried about the impact of this on their future, and I'm worried about contingency plans. Government has a responsibility to be prepared for every outcome, positive or negative, but particularly potential negative outcomes of things that happen in this province. The Premier mentioned the pensioners as a specific group, current and future pensioners, and I'd like to ask the Premier: does he have an understanding of the potential ramifications on the pension plan and the pensioners should there be a slowdown in service, or should the mill cease to operate in this province?
The Honourable Premier.
Thank you, Mr. Speaker. The current owner, Mr. Speaker, Bononi, taking over that company, actually made an installment into the pension plan to provide stability. There's still some ongoing work that will need information that will be required, we believe. At this point, Mr. Speaker, that issue, that those families who are currently receiving income from that will remain still supported by that, but it is in. I want to again reiterate for the third time. It is my hope that the company will continue to comply to ensure it provides the information that would allow it to meet the environmental standards of this province. So, Mr. Speaker, we can protect the jobs not only at that mill, but in communities across the province.
The Honourable Leader of the New Democratic Party.
My question, Mr. Speaker, is for the Premier. Yesterday, I was happy to attend a rally for a $15 minimum wage at the office of the Minister of Labour. And speaker after speaker there made the one clear, repeated point that yesterday's 55-cent increase in the minimum wage is not enough for anyone to live on. Even if they bring in equivalent increases as are planned over the next 2 years, minimum wage workers in Nova Scotia in those 2 years' time will still be making less than minimum wage workers make in Ontario and Alberta today. At $11.55, our minimum wage is 9th out of 13 Canadian jurisdictions. Why does the Premier think that people in Nova Scotia can afford to work for so much less than everybody else?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the gentleman for the question. As you know, we're using the formula that was put in place by his government when they were in power, Mr. Speaker. We continue to follow that. But this particular time, Mr. Speaker, we increased it more than what that formula would have allocated for. We'll see the minister has also announced there will be a similar increase next year. That is one component, Mr. Speaker, of how we support Nova Scotia, low-income families across the province. Basic personal exemption, Mr. Speaker, is on a sliding scale. Those who require our support the most when it comes to income tax bracket are getting it, Mr. Speaker. Same time, the rent subs that we've increased to 109 so that we can provide an affordable option, a living for low-income Nova Scotians, to look at not just, Mr. Speaker, their paycheck, Mr. Speaker, but also look at how can we support them through the entire living experience in Nova Scotia.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, the low-income personal exemption that the Premier speaks of brings to the average person filing taxes a benefit of $13 a month. To move from $11.55 minimum wage to $15 minimum wage would change one's income by $550 a month. I'm not the most brilliant mathematician in the world, but I can even do that in my head. That's $537 monthly. Mr. Speaker, yesterday's 55-cent increase, it doesn't even make us the highest in the Maritimes. That's PEI, which, by the way, continues to have the region's highest projected economic growth. And there's a reason for that, because economic growth isn't possible unless ordinary people have some money in their pocket they can spend. So I want to ask the Premier, how can our economy in Nova Scotia generate the spending we need in order to move out of being the poorest province in Canada when the government has us stuck at 11-something?
The Honourable Premier.
Speaker, the success of Prince Edward Island, Mr. Speaker, is no government has had to follow a Democratic Party government in PEI, Mr. Speaker. That's been kind of their success. Mr. Speaker, after we, Mr. Speaker, dug ourselves out of a $600 million hole in 2013, we continue, Mr. Speaker, to make the investments, ensuring that we follow the formula that was set out by the Democratic Party when it comes to raising the minimum wage, except this particular time, Mr. Speaker, we've increased it by 55 cents. Minister of Finance has also indicated, Mr. Speaker, that will be another increase of 55 cents. We continue to make sure that we reduce the basic personal exemption. We look at how do we provide rent subs. How do we continue to deal with the issue, Mr. Speaker, of affordability? As he would also know when he was in power, he saw power rates skyrocket under their leadership of the Democratic Party. Today, Nova Scotians see stability when it comes to power rates. Those are all positive ways, Mr. Speaker, as we continue to work with the one issue that the honourable member is focused on, which is the minimum wage. It's more helpful than I believe for low-income families that we look at all the myriad of options that we can help them with the expenses of living.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, the Premier touts the credentials of his government in the area of economics, but in my view, the real outstanding economists in Nova Scotia today aren't anyone in the government or anyone in the banks. They're rather the people who, through resourcefulness and hard work and their wits, manage most of the time to more or less get by, although they're not making any more than 11, 12, or 13-something an hour. Not one of those people thinks that we're going to seriously be able to address having the lowest median income in our country with a minimum wage of 11-something, and not one of them thinks either that this change is going to make an appreciable difference in their spending power. I want to ask the Premier, does he think it's fair that so many people are having today to live in Nova Scotia on $11.55?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question again. He's focused on one aspect, Mr. Speaker, the support we provide to low-income Nova Scotians. Mr. Speaker, I want to tell him there are a myriad of options on how we continue to provide stabilities for families in this province. I would also want to tell the honourable member the most important thing that we can do for all citizens of this province, continue to grow the economy and provide good jobs. Mr. Speaker, the fact of the matter is there are more people working in Nova Scotia than ever before in our history today, Mr. Speaker. Unemployment is an all-time low, Mr. Speaker. Those are all positive signs. We're helping, Mr. Speaker, lift Nova Scotians into success, allowing them to charge their own destiny, providing them a job opportunity, growing the economy, Mr. Speaker, letting them see the hopes for themselves. He should celebrate the fact that more young people, for the first time for 3 consecutive years, Mr. Speaker, more young people are staying in this province and leaving. Those are all good signs. Mr. Speaker, is there more work to do, Mr. Speaker? Of course there is, and we're going to continue to work with those Nova Scotians to make sure that everyone sees themselves and sees a future here in this province.
The honourable member for Kings North.
Thank you, Mr. Speaker. My question to you is to the Minister of Health. Last week during budget estimates, I asked the Minister of Health if the government was studying suicide. He said there was work underway and that it involved experts in the field. It's important to study suicide so we know that the mental and health investments are being spent in the right way, but I worry when the study is limited to professionals. So my question through you to Mr. Speaker, to the Minister is, does he intend to include first voice accounts or have public input, or will the study be limited to the professionals?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank him for raising this important question. I think it's a question, a topic that interest is shared across the floor. In fact, as we discussed during estimates, this, Mr. Speaker, is the fulfillment of a commitment, recommendation was made by Dr. now Senator Stan Kuchar back when I first came into this role to update the provincial suicide prevention framework. So this isn't, I guess, a review in the context. I think the member's raising the question now, but more broadly, specifically towards a clinical type of piece of work with respect to an approach for reducing and preventing suicides in the province.
The honourable member for Kings North.
I'd like to thank the Minister for that answer to you, Mr. Speaker. Mr. Speaker, an article in the Chronicle Herald this week states that more public engagement is needed to prevent suicides, and I'll table that argument. Some of the most valuable insight I've had in the mental health services have come from those who have experienced the system firsthand. Advocacy groups like How Many, NSHA, IWK provide insight and experience from different perspectives than professionals, and it shapes a fuller picture. My question to the Minister, Mr. Speaker, is has the Minister reached out to mental health advocacy groups to help gather statistics and know where investments are most needed?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, the work on the suicide prevention framework is in response to a recommendation that this piece of work, which I believe was somewhere in the vicinity of 20 years old, was appropriate to be updated in light of the circumstances, looking at that it would be appropriate to look at the data and the information in Nova Scotia, but also look at best practices from across the world, across the country, and engaging with experts that have the clinical expertise to help inform the path forward and the steps forward that we can then roll out throughout our mental health system to again achieve the objective that I would think we all share, which is a reduction in the number of attempted and certainly reduce the number of completed suicides in this province.
The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Labour and Advanced Education. Nova Scotia is the only province in Canada with a separate minimum wage for inexperienced employees. While other provinces have separate minimum wages for liquor servers, home workers, security guards, live-in camp leaders, and other specific occupations, no other province imposes a 3-month probationary period on all employees who are new to an industry. Mr. Speaker, when no other province imposes a blanket policy like this one, why is Nova Scotia leading the way in wage discrimination?
The Honourable Minister of Labour.
Thank you, Mr. Speaker. It gives me pleasure to rise and to explain the 50-cent differential we have for inexperienced workers. It lasts 3 months, Mr. Speaker, because that is the period that we look at for a worker to gain some experience on the job. The member brings up what other provinces do, and what they do is they have differentials of 80 cents or $1, which targets the liquor servers, which targets youth. And Mr. Speaker, I will add that in those differentials, that differential always remains. In the process we have in Nova Scotia, which we have currently, which we had under the NDP government, which we had under the Conservative government, is a very small amount that the employer would save, which would amount to about $240 over 3 months. And what that is to assist the employer to pay for training costs, to actually have job shadowing for that employee, and to allow that employee to gain the skills in their first job so they can move on and have more employment and have more income. Thank you, Mr. Speaker.
The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker, and what a perfect segue into my next question. Mr. Speaker, we're worried that low-wage workers, and especially young workers, are being taken advantage of by this policy. Those moving back and forth from their home communities to go to college or university are particularly vulnerable. We've heard stories of young workers who, having worked for years at a McDonald's in Sydney, are told by their new employers at a McDonald's in Halifax that they will be paid the inexperienced rate. If employers want to reduce costs associated with training new workers, the department could provide assistance to help them make business decisions to reduce that turnover rather than passing those costs on to the workers. Mr. Speaker, will the minister commit to ending the discriminatory, inexperienced minimum wage now?
The Honourable Minister of Labour.
So, Mr. Speaker, what I would say to the member is that if any employee is working at a McDonald's for 3 months and goes to another McDonald's or goes to a Wendy's or a Harvey's or anything in a fast food industry, after 3 months at one organization, even if they go to a completely separate company, they cannot be paid the inexperienced worker rate. So what I would say is that if that practice is happening, those companies are breaking the labour laws in Nova Scotia, and that employee should report them to the department, and we will investigate, and that employee will be owed back wages. Thank you, Mr. Speaker.
The honourable member for Pictou West.
Thank you, Mr. Speaker. My question is for the Minister of Health. A CBC article yesterday outlined the lack of regulations in the massage therapy industry, and I'll table that story. It tells the story of a massage therapist facing nine accounts of sexual assault and waiting trial, yet he is still able to see clients. This lack of regulation has left women feeling vulnerable, and I can only imagine how the women who came forward with complaints feel about this individual. A lack of regulation in the industry means his only condition right now is being supervised when he is with female clients. So my question is, does the minister believe the massage therapy industry is adequately regulated in this province?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member would know, there are a number of self-regulated professions within the province. In fact, one of the bills before us here in the legislature around the nursing profession relates to that topic. The work that gets done to inform the self-regulation, a lot of it is focused on the clinical aspects. Of course, the situation highlighted in the article is concerning. I think it's concerning to all Nova Scotians if an individual in a position of trust violates that trust, and as the allegations in the particular case that's been presented in the media again raises concerns, I think, for many Nova Scotians, including us.
The honourable member for Pictou West.
This story would be troubling any day, but it's especially troubling to hear this story during Sexual Assault Awareness Month. Massage therapy clients are vulnerable. They're often at least partially nude. Many are battling chronic pain, and they trust their massage therapist to act professionally. Not properly regulating the industry has people who put their trust in the hands of their massage therapist only to have it violated, with very few options to seek for justice. Allowing someone who is accused of these 9 crimes to continue practicing is a failure of this system in this province. So I will ask the minister, will the minister work with the industry to ensure stricter regulations are put in place to keep clients and therapists safe?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Indeed, we work with many stakeholders, organizations, and health industry organizations to establish and define the parameters for self-regulation and oversight in the health professions. By and large, these are self-regulated professions. We've developed as a government a more formalized framework for what it entails to put forward a self-regulated body. That's some work that's been done in the last couple of years, and we apply that. So we we do work with groups and organizations, and we have a number that are in progress now throughout the health system. So we continue to do that work and advance self-regulation opportunities as we're able to do so.
The honourable member for Pictou West.
Thank you, Mr. Speaker. Continuing on with the Minister of Health. This government may deny it at every opportunity, but healthcare in Nova Scotia is beyond a crisis situation. It's gone to a whole new level. Everyone who works in healthcare knows it, Mr. Speaker, and every person seeking healthcare knows it. In fact, everyone in this chamber knows it, although many will continue to deny it, Mr. Speaker, with a government member recently preferring the word pressures to the word crisis. Frontline healthcare workers have offered ideas and solutions through 2 reports, Mr. Speaker, Code Census and Code Crisis. So I would ask the minister, why has he largely ignored these 2 reports from frontline workers?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the question from the member. What I would advise, Mr. Speaker, the members for the legislature is, in fact, we do take the concerns of our frontline healthcare workers seriously. With respect to the concerns being raised, we do work with our stakeholders, we work with our partners in the delivering the healthcare to Nova Scotians, and we see changes. We see actions, Mr. Speaker, being taken, for example, as we've talked about at the Health Committee recently, in our emergency departments for offload transfers from paramedics into the hospital system to get our ambulances back out on the front line. Mr. Speaker, that was one of the predominant themes and requests from the paramedic field, Mr. Speaker. That's listening, that's responding to those concerns.
The honourable member for Pictou West.
Mr. Speaker, the first step to fixing a crisis is admitting there is a crisis. As long as this Liberal government continues to split hairs and refuses to acknowledge the crisis, our emergency departments will continue to be overcrowded, chaotic, or closed altogether. You will continue to read those stories daily in the Chronicle Herald. I implore the minister to do the right thing and stop denying a crisis situation. So will the minister please, let's put away the talking points and tell Nova Scotians that he hears them loud and clear, that he agrees with them, and that Nova Scotia is in a health care crisis.
The Honourable Minister of Health.
Thank you, Mr. Speaker. Indeed, I can assure the member opposite, and indeed all Nova Scotians, that I do hear them. I hear from Nova Scotians in communities across the province. I hear from healthcare professionals from a variety of fields, Mr. Speaker. Where perhaps the member and I may come to disagreement is that I believe actions speak louder than words, Mr. Speaker. And I believe the efforts that we make, the investments we make, and the changes we're making in our healthcare system are the actions we're taking to improve the healthcare system for all Nova Scotians.
The honourable member for Pictou West.
Mr. Speaker, my question is for the Minister of Health. The only way to address the healthcare crisis is through an open, honest dialogue. That is what we need, because we aren't seeing any action. Frontline workers have been pleading with management to call a code orange in hospitals, but they have been denied time and time again. They are calling for a code orange because they are entering a work environment that they know is in a crisis. Being denied that request only increases uncertainty and anxiety for both patients and staff and family members. So my question for the Minister of Health, does he believe that frontline workers should be the ones who decide whether or not code orange is a call worth warranting?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member has raised the question around our emergency departments and the environment there, again, I'll reiterate that this is a concern that we've heard raised, and it's one that we've engaged and brought together. And, Mr. Speaker, the partners in our emergency systems, the health authorities and the EMC that provides our EHS ambulance services, had them come together, Mr. Speaker, to put together some planned course of action to take action to improve the situation. Mr. Speaker, the first action point of focus is on the transition. That is for paramedics that arrive at the hospital to transition their patients into the hospital system. That, Mr. Speaker, will have a positive impact. And, Mr. Speaker, there's more actions coming from that plan as well.
The honourable member for Pictou West.
Well, I hope there's more action, because right now that may be happening in HRM, but from what I understand, that's not working very well either. But what about the rest of the province? Calls for a code orange are a symptom of a system stretched well beyond a breaking point. It's a symptom of emergency departments that are backed up and overcrowded, creating chaos for both patients and healthcare workers. My question for the minister: when will he admit our emergency departments are working in less than favorable conditions, creating a dangerous environment for our patients and our employees?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, I'll share with the member actions being taken as part of the planning and the work being done by the Nova Scotia Health Authority to help improve patient flow through our emergency department and our hospital system. I've talked about the offload piece quite extensively, but Mr. Speaker, another piece of action being implemented by the Health Authority includes the ability of nurses to requisition things like x-rays and digital imaging from the emergency department so that the patients don't have to wait for a physician to have move that way through. And Mr. Speaker, whether or not the member believes that's happening on the ground, I had a family member, Mr. Speaker, who was at the hospital at St. Martha's in Antigonish, a healthcare worker themselves who came home and started to explain to me how this great new change was happening at St. Martha's. And Mr. Speaker, that's part of the action that's taking place because of the planning and the implementation, because the Health Authority and the government knows that we have challenges and we're working to improve them.
The honourable member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Fisheries and Aquaculture. Last week, the minister dismissed the NDP's call for a $15 minimum wage, saying, quote, "No one is going to pay minimum wage for a good employee." Mr. Speaker, the majority of the 4,000 Nova Scotians, mostly women, who work in fish processing are paid less than $15 an hour. The minister's comments suggest that they are receiving such low wages because they are not good workers, when in fact, the reason they are paid so little has nothing to do with their work and everything to do with this government's refusal to raise the floor to a minimum wage of $15 an hour. So my question is, will the minister please apologize to all fish plant workers and explain his comments?
The Honourable Minister of Fisheries.
First of all, no time did I ever say that workers in the fish plants don't do great work. They actually do. And indeed, I remember my comments very clearly. I very clearly said anybody working in a fish plant that does great work gets more than minimum wage.
The honourable member for Halifax Needham.
Mr. Speaker, the Premier constantly reminds us that our seafood exports are booming, yet workers in that industry are not seeing the benefits. Average hourly compensation for fish plant workers has decreased every year since 2014 and is in fact now lower than in 2009. Wages can't be dropping because of global competition because our exports are booming. Wages can't be dropping because of a labor surplus because fish plants can't find workers. The only reason wages are so low is because this government refuses to do the right thing and raise the minimum wage to $15 an hour. So will the minister support a $15 minimum wage so that our export boom actually benefits workers?
The Honourable Minister of Fisheries.
Thank you very much. And indeed, most of our workers in the fishing industry at 10,700 make well above minimum wage, very much well above minimum wage when you look at the whole industry. And the fish plant workers, as I said earlier, anyone in the fish plants workers that are really good employees, come back to work all the time, get more than $15 an hour.
The honourable member for Pictou West.
Mr. Speaker, my question is for the Minister of Health. Overcrowded and understaffed emergency departments come at a long-term cost. Allied healthcare professionals, believe it or not, are exiting for other provinces and actually leaving our country completely. They're headed elsewhere, where they know working conditions are safer for them and their patients, and they will actually feel respected by their government. Morale for our healthcare professionals is at an all-time low, and continued inaction by this government only worsens that. So my question for the minister, what is his plan to ensure safe work conditions and put an end to out-migration of healthcare professionals?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Indeed, the question of safety in our health workplace is something that came up just, I believe, in the month or so before I came into this role. Particularly, Mr. Speaker, unions representing the nurses brought forward some recommendations. We've been working with them to implement changes. Indeed, some of those changes have been implemented, particularly in areas like our long-term care sector, helping, Mr. Speaker, provide the equipment needed to help ensure there's more safety in the delivery of the care, both for the residents, Mr. Speaker, and for the staff who make the changes and have to move residents around.
The Honourable Member for Pictou West.
Mr. Speaker, there is no dignity for someone who goes to the hospital for treatment and spends days, even weeks, in a stretcher in the hallway. Doctors, nurses, and healthcare professionals don't have to apologize, shouldn't have to apologize to patients and feel guilty for the conditions they're being treated in. Family members shouldn't come to visit loved ones and leave bewildered at the state of healthcare in their very own province. People shouldn't have to drive across this province to receive care in an emergency department. What specifically does the minister believe will change these negative experiences that we're all reading in the papers and watching on the news daily to positive ones for Nova Scotians?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And first, I believe, Mr. Speaker, that the member opposite, although she's focused on the negative experiences that she's referenced, I have to expect, Mr. Speaker, that like other MLAs, including myself, that the member also receives and hears positive experience from our healthcare system, because there are many positive experiences, Mr. Speaker, that Nova Scotians are receiving great health care, Mr. Speaker, in many parts of our healthcare system. That, Mr. Speaker, we still have some challenges, and we're focused on implementing changes to improve the situation where we do have challenges. But make no mistake, Mr. Speaker, there are many, many parts of our healthcare system that are providing great care for Nova Scotians.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. There are some good stories, but we all know no one comes through our constituency doors with good stories. We are here to oppose. There isn't an emergency department in this province that isn't under immense stress, Mr. Speaker. Patients are being treated, they are sleeping, and they are dying in hallways. They are dying in hallways, Mr. Speaker. Paramedics and frontline healthcare workers are burning out and finding themselves overwhelmed with the lack of resources to allow them to properly do their jobs. None of these conditions set us up to be able to properly treat our sick. My question for the Minister of Health, will he admit that there is a lack of resources for our emergency departments in our province?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question about our emergency departments. We understand the pressures that are faced at many of our emergency departments, Mr. Speaker, in various parts of the province. Mr. Speaker, I've recounted before the experience in Cape Breton, where my first trip down there, the emergency department was really the highlight. That was the focal point that staff wanted to bring me to show me at the Cape Breton Regional, Mr. Speaker, that it needed to be redeveloped, it needed to be expanded, they needed those investments. They needed those additional resources, Mr. Speaker, and we've listened to them, we've implemented, and we're making those changes, Mr. Speaker. So we're listening, we're hearing, and we're making those changes.
The Honourable Member for Pictou West.
Mr. Speaker, denial gets us absolutely nowhere. Both patients and staff across this province are being forced to muddle through unacceptable and dangerous environments as they attempt to provide or obtain health care. We know better than this. We can do better than this. We have to do better. Does the minister perceive this crisis to be the fault of administrative and bureaucratic barriers, or does he feel there's an obvious lack of political will by the Liberal government to fix it?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, as being the health critic, that the challenges that we face in parts of our healthcare system, attachment to primary care services, Mr. Speaker, and emergency departments, two that are most frequently talked about in our publicly, Mr. Speaker, that these are challenges that are reflective of challenges in the healthcare system across the country. And indeed, Mr. Speaker, in many of these areas, the investments, the changes, and the work that we've been doing, we see ourselves faring fairly well on that national stage. Mr. Speaker, just for example, in primary care, Stats Canada shows that in 2017 that we are the fourth most people in the province attached to primary care providers. Mr. Speaker, that is the situation on the ground here in Nova Scotia. We know that we have the fourth best coverage of the country based upon that Stats Can data, but we know that there's more work to do, and that's why we continue our investments to improve primary care access across the country.
The Honourable Member for Pictou West.
Mr. Speaker, there may not be an ambulance available when you need it. These are the stark words of warning from Terry Chapman, the Executive Director of the Paramedics Union in Nova Scotia. Think about that. You call 911 and there may not be an ambulance available. Mr. Chapman believes that the province needs 30 more ambulances and 200 additional paramedics. That's just, Mr. Speaker, to alleviate the short-term offload delays. A sustainable system, Mr. Speaker, is a whole other matter. So my question for the minister, how much of the $4.6 million increase in EHS funding is dedicated to purchasing more ambulances?
The Honourable Minister of Health.
Thank you, Mr. Speaker. The vast majority of that increase of $4.6 million to the EHS system is actually targeted towards responding to increased call volume, Mr. Speaker. That is money going to pay for the ambulance calls that Nova Scotians make when they require an ambulance to ensure that it's there for them. I believe, Mr. Speaker, the exact dollar figure and the breakdown I have to look up, but again, the vast majority of the 4.6 is going towards responding to increased call volume. That is going to pay for those ambulance calls, so that Nova Scotians call, we make sure that we're paying the bill.
The Honourable Member for Pictou West.
Paramedics, Mr. Speaker, are feeling undervalued and defeated by this government. They have been working 4 years without a contract. These are the men and women who answer our calls during our darkest and most vulnerable moments. They save lives. 24/7, they're out there saving lives. They sometimes work 12 hours or more with no breaks. Working conditions have become so stressful that some paramedics are moving out of Nova Scotia to work in more favourable conditions elsewhere. Is the minister concerned that many paramedics would sooner move to Alberta than wait around hoping for better conditions in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for, again, raising this question about the work environment for paramedics in the province. Mr. Speaker, we've talked about this in question period before. Frequently, we've had a health committee meeting on this very topic. Mr. Speaker, this, as I've assured the members of this legislature in the fall, is an area of concern. It's an area that I felt that the appropriate course of action to take and improve the situation for paramedics was to bring the Health Authority and the EMCI together to come up with actions to move forward. Mr. Speaker, we heard at the Health Committee that that work is ongoing and targeting the 5 regions that have the most pressure at the transfer of patients from ambulance to the hospital, and that work is underway, Mr. Speaker.
The Honourable Member for Pictou West.
Mr. Speaker, currently the Department of Health and Wellness has no long-term strategy in place to ensure stable emergency care capacity for all regions within our province. The state of our province is one in which patients are being treated and, sadly, again, dying in hallways. It is a state in which the morale of doctors, nurses, paramedics, and many other allied healthcare professionals is dangerously low. With our healthcare system in such a state, Mr. Speaker, will the minister put aside partisan concerns and commit to bringing all parties together to find solutions to the emergency care crisis in our province?
The Honourable Minister of Health.
Thank you, Mr. Speaker. First, again, I want to highlight and stress, Mr. Speaker, that the member is only bringing examples of one particular perspective of what it gets, the challenges being experienced in emergency departments. Mr. Speaker, I want to assure the member and all members of the legislature that, in fact, what happens in our emergency departments is people's lives are being saved, Mr. Speaker. People's lives are being saved when they go to our emergency departments because of the hard work and the dedication of our frontline healthcare professionals, Mr. Speaker. And let that not be lost on any member of this legislature or any person in Nova Scotia. That is what happens more often than not, Mr. Speaker. That is the experience of Nova Scotians when they show up to our emergency departments, and let that not be lost. I find it ironic, Mr. Speaker, that the member would be talking about politicizing the situation, Mr. Speaker, and ignoring that the vast majority of experiences are not as the member has illustrated.
The Honourable Member for Pictou West.
Believe me, Mr. Speaker, I've been sitting down with frontline healthcare professionals. They know how appreciative I am, how appreciative our government on this side is of their work. The message that the Minister and the Liberal government is sending out to Nova Scotians is that they only know how to work in silos. We all know that working together towards a common goal is the best way to achieve results. Several weeks ago, the government denied my call to bring us all together with stakeholders to examine solutions for paramedics. I asked to be united so that we could share some good stories. But in fairness to the minister, he was not at that meeting. So I'll ask the minister today, is he willing to meet with paramedics and opposition parties together to try and improve the conditions for emergency care workers?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Of course, Mr. Speaker, hearing the voices of the frontline healthcare workers is an important part of influencing the work that we do. I can assure the member that throughout our healthcare system, those conversations take place at the staff level, and Mr. Speaker, indeed, right up to and including myself. I meet and have met on multiple occasions with representatives of frontline healthcare, Mr. Speaker. That includes the paramedics union, the nurses unions, Mr. Speaker, unions representing other frontline healthcare workers. We listen to them, Mr. Speaker. I hear from them. They influence the path that we take. And, Mr. Speaker, we also meet with our partners and the employers, Mr. Speaker, the Nova Scotia Health Authority and EMCI, Mr. Speaker, to come together with the plans to move forward. And that, Mr. Speaker, is exactly what's happening in our healthcare system today.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question is for the Minister of Environment. An Environment Canada report leaked yesterday shows that due to climate change, Canada's temperatures are going up twice as fast as the rest of the world. This report says that if we stay on the track we're on now, we'll have storms like Hurricane Juan every second year. The report concludes that Canada needs a dramatic reduction in greenhouse gas emissions immediately, that this is urgent. But this government has chosen a target that slows down the pace of our reductions. And Mr. Speaker, that's like watching a house on fire but turning down the fire hoses. So I'd like to ask the minister, given the findings by Environment Canada, in all honesty, does she not regret her government's choice to slow down our emissions reductions?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I'd like to thank the honourable member for that question. It certainly was alarming to hear that statistical information yesterday. We know that they say just in the last few years our temperatures have risen by 1.7 degrees. I believe it's been just in the last few years. But I am glad to report that Nova Scotia is a leader in reducing greenhouse gases. You know, we have reduced greenhouse gas emissions by 30%. Actually, it's more like 32, 33% now, below the 2005 levels. We have made the most aggressive commitment across this country of 45 to 50%, a goal by the year 2030. You know, we know that coastal mitigation is going to be, or that we have some issues that we have to deal with, and certainly coastal protection is part of that. And that's why I hope to be able to pass the coastal protection bill in the next few days in this House. Thank you, Mr. Speaker.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Well, my follow-up question is for the Minister of Agriculture. Sea level around the Bay of Fundy has already gone up 40 centimeters, and it will go up even faster in the next 10 years. The Isthmus of Chignecto has almost flooded twice in the last decade, and fiercer storms are on the way. If the next hurricane hits at high tide, projections show that the Trans-Canada will be flooded up to our car windows and flood right into Amherst. And the minister told me in budget estimates that he's partnering on a study to figure out what to do about this, but the study might not be done for another 18 months. As David Cogan, mayor of Amherst, says, if I were in charge of it, it would be underway now. I'll table that, Mr. Speaker. So will the minister please tell us, the agricultural minister tell us, why the request for proposal has not been issued yet, and will he commit to starting preparations now so that work can get started as soon as the study is done?
The Honourable Minister of Agriculture.
Thank you very much for the member's question. Indeed, we're doing a tremendous amount of work around the dikes in the province, and we have a $50 million project underway now. We described it very early in estimates.
The honourable member for Cape Breton Richmond.
Mr. Speaker, on March the 2nd, 2018, I raised a question to the Minister of Transportation and Infrastructure Renewal regarding flooding conditions on the Loch Lomond Road. A truck from the minister's own department was engulfed in the flooding conditions, and at the time, the minister stated that he was aware of the Loch Lomond Road situation and that staff are looking at some solutions in terms of drainage there. Again, in May of 2018, the minister was made aware of a potentially fatal situation when two seniors had their car fully submerged on the flooded roadway. They were lucky to escape with their lives, Mr. Speaker. In both instances, there was no permanent signage to warn of the danger. Mr. Speaker, I'd like to ask the minister when he finally plans to make the necessary repairs to the Loch Lomond Road.
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and I thank the member opposite for the question. The Loch Lomond Road, like many other low-lying roads in the province, are the subject of ongoing review by the department to find the proper mitigation. We're in a situation where we've had quite a significantly wet winter, and that continues. We're having more rain coming. We've had all kinds of activity which has been highlighted in the House because of the climate change issue, and we are constantly reviewing those situations, including the Loch Lomond Road. Thank you.
The honourable member for Cape Breton Richmond.
Mr. Speaker, the people of Loch Lomond and the travelling public deserve to feel safe and not run the risk of drowning on a local roadway. Again, I'll say that again, drowning on a local roadway. Mr. Speaker, the solution on the Loch Lomond Road goes well beyond a few $1,000s that were spent last year to try and do some ditching mitigation at the end of the line. We've got a series of collapsing culverts on the old mine site. The minister would like to come and take a walk with me. I've walked the entire site. Doesn't take like a lot to figure it out. So I would like to ask the minister again, will he direct his staff to please permanently rectify this public safety issue on the Loch Lomond Road this fiscal year?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I thank the member opposite for the kind invitation to go for a walk. However, I would like to point out that in the last 4 years, this government has driven the budget, the capital budget for road repairs in this province to an excess of $1,025 million, Mr. Speaker. The largest increase, sustained increase in the history of this province. It's only going to get better, and we're going to take care of the problems universally across the province, including the Loch Lomond Road.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. My question is to the Minister of Health. On March 12th, I asked the minister about a constituent's experience being sent back from Halifax to Roseway in the middle of the night because no beds were available. I'd like to update the minister and let him know that this constituent has now been waiting over a month for a specialist that could make the difference between mobility and potential paralysis. That's over a month, not for an appointment, but a call to confirm an appointment date. My question for the minister is, does he think that's an acceptable wait time for such a serious, time-sensitive medical need?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. I have to say, Mr. Speaker, I don't think I have enough clinical details from the description the members described there to draw the conclusion that she would like me to, I think. But certainly, I hope the member, Mr. Speaker, through you, if she does have more details on the specific case and constituent, that we can take a look into that, see what the specific clinical condition and the specialists that they're looking to meet with to further evaluate their situation. Again, with the broad description, obviously we're not going to get into individual personal details on the floor of the legislature, but I do want to make sure the member, Mr. Speaker, knows that I'm open to having that conversation.
The honourable member for Queens Shelburne.
Mr. Speaker, I don't have enough time to finish the rest of my question, so I will thank the minister for that response. I do have a signed authorization, so I will follow up with him after the House today so we can talk about how we can go forward and help with this constituent in Shelburne County.
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for that. I look forward to getting the additional information. And just as the member noted, I'll just take the opportunity for a little PSA. Just a reminder for members of the legislature to remind your constituency assistants when you do have health-related concerns from constituents, get the privacy waiver signed in advance. We can move forward a lot more smoothly and quickly and timely for those members.
Thank you very much.